Hello and welcome to the Quincy Access Television studios. Thank you for joining me for Your Health, a program that obviously deals with health topics. Today I have as a guest Christine Kosha. She is the tobacco treatment specialist in the city of Quincy. Today's topic is social media's impact on young people and smoking. Christine, welcome back.
Thank you for having me back, Mark. It's nice to be here.
We have covered smoking in a variety of subtopics. This one I thought was important because youth is simply impressionable.
Absolutely. I think, as we were talking about a little bit earlier, when in the days when we were growing up, the only thing we really had to worry about as far as pressure to smoke was from friends, maybe seeing it in school, things like that. But today with social media, kids are being exposed to smoking more than we ever were. And it's really becoming an issue because depending on what they're looking at when they're online and when they're talking with friends, that kind of thing, chances are there's going to be someone on there that's smoking, or they're going to see something related to smoking.
Right, which brings me maybe to our first topic, and that's normalization.
There are a lot of people online now, of course, as you would imagine, that are promoting smoking, vaping, things like that. I've come across people who call themselves Zinfluencers, which are people who promote the nicotine pouches. And then we have people who call themselves Cigfluencers. Same thing, people who are promoting cigarettes. So they're online, they're out there, and kids are being exposed to these things. So the more that they go and they go online, like I say, chances are they're going to see something that's going to be related either to smoking cigarettes, vaping products, or the nicotine pouches, which we've talked about before.
And when I say normalization, it's what they perceived or what they perceive as normal behavior.
Exactly. If they're seeing these things show up on social media, you see other influencers that are on there promoting cigarettes, smoking, or vaping. You see celebrities that are on there. Oftentimes you'll see them posting things. And just movies now, I mean, I'm noticing that you're seeing more smoking in movies now. For a long time you didn't.
So it's coming back?
It looks like it's coming back, yeah. I mean, of course, back in the 50s, 60s, things like that, you did see a lot of smoking. But then it sort of went away. I didn't see it as much, but now I think we're starting to see a comeback with it. And again, not just with the cigarettes, but with vaping as well. So we're seeing smoking in a lot of different ways. So that is influencing kids. They're seeing it pretty much everywhere they go.
Before the cameras were rolling, you shared a story, which I'd like you to share with the folks at home, about the Flintstones.
Yes.
The cartoon.
Yes. So we were talking about that a little before our time, but when the Flintstones first started, which was, I believe, in the early 60s, they did have television commercials that came on in between the show, the commercial breaks, that featured Fred and Barney actually smoking cigarettes. So I believe there were Winstons at the time, and they were promoting the Winston product, but it showed them smoking behind their house, I think it was. If you watch it, you can see the commercials, the old commercials now still on YouTube, but you would see them, and it's very interesting to see. You have these favorite cartoon characters that you grew up with, and then to see a commercial like that. But I was made aware of that just not too long ago by someone, and when I looked it up, it was pretty interesting to see.
I got to go look back at some old YouTube videos, I guess.
Yes.
And try to find that myself. So I guess this goes along with what we're discussing. It's the glamour aspect.
Yes, absolutely. Again, as I mentioned, you're seeing a lot of celebrities today. All of these things that are being posted by people, even sports figures. I just did something about a month ago in the Quincy Sun on cigar smoking. And just the fact that for decades, that's been promoted by not just celebrities, but sports figures, politicians, people like that. They're promoting cigar smoking and making it look sort of the cool thing to do. So you're seeing a lot of that now on social media. You have a lot of younger celebrities that, again, it's not just cigarette or vaping, but it's also these nicotine pouches. So you're seeing a lot of them promote that. And of course, when younger people see that, they get that impression that it's a cool thing to do.
And as far as advertising, because all of this is a form of advertising, we spoke earlier about Juul.
Yes.
And the flavored cigarettes and how they're advertising, targeting younger folks has been stepped back.
Yes, absolutely. Something else, again, years ago that you would see a lot of, if you and I remember billboards that would be up, you'd be driving in any community or on the highway and you would see these billboards promoting smoking. Cigarette articles or magazines would have ads in there for cigarettes as well. So a lot of that was sort of wiped out, and you don't see it as much anymore, although I do think you're seeing some cigarette advertising popping back up in certain magazines. But the billboards were really always very interesting because it was depending on where they were and the population that they were trying to target. The menthol cigarettes were popular, as I mentioned, with the African American community. So if you drove through certain sections of Dorchester or maybe Mattapan, Roxbury, you would see billboards for Newport or Cool. And, you know, a lot of times you would see the Marlboro. We talked about the Marlboro Man. That was another one that kind of represented a very rugged kind of look. So you would see that in several places. And then, of course, the Joe Camel campaign that we talked about as well, which was very clearly targeting kids. You had the cartoon camel, and those billboards were up in quite a few places. And the merchandise that they had at the time, a lot of cigarette brands were giving out things, Marlboro, but the Joe Camel, they had a lot of products that they gave out, and they were specifically targeting kids.
And that brings me to this point. It's subtle. Sometimes it's subtle. So the giving away of a free product is subtle.
Yes. Yeah, absolutely.
The logo is on there.
Yes, absolutely. You see, I can remember even in my own home, someone, I think one of my siblings, got a set of grilling tools that had the Marlboro logo on it, and I always remember seeing that in the house. But yeah, they would show up at certain events, and they would have promotional items that they would share with people. And so I think you're seeing a lot of that still going on, but it's just become a more, it's now that it's part of social media, kids are picking up on it. They're seeing things that are being promoted. A lot of the advertising is done in such a way where it doesn't really look like advertising, so it's being snuck into some of the things that kids are looking at online.
Always an issue with younger folks, peer pressure.
Yes, absolutely. Another thing that the kids probably see quite a bit is friends who are posting things, maybe on Instagram, maybe on one of their social media sites, of themselves smoking. And again, I think we're used to having or remembering that whole peer pressure thing even before social media, but that was always there. The idea of you're not cool unless you smoke or unless you vape. And
so it's like social validation.
Yes, exactly. Feeling accepted by your peers. I think you do see a lot of that still going on. It's only become more enhanced now with social media because they're kind of accessing that, and they're being exposed to it pretty much every day.
Let's look at misinformation. So you have smoking, then you have vaping.
Yes.
You have the pouches.
Yes, absolutely. So that's another thing that's out there. I think a lot of times you'll have information that's on there, which is very common with anything that you read online. You know, the saying, like, don't believe everything that you read online. It isn't necessarily fact, but I think there are a lot of people out there who try to make things like vaping products and nicotine pouches, which are so popular now, sound less unhealthy than they actually are. I know we talked about this before, but with the Zyn or the nicotine pouch products, I should say, there's sort of a gray area with them as far as being regulated. So a lot of times you might find a container of nicotine pouches that may say they contain a certain amount of nicotine, when in fact they may contain more than that. And they really need to do a better job of regulating pouches, because they're sort of in that area where they're not cigarettes and you're not smoking them. So they tend to get around some of the laws.
So I guess when in this case, younger folks are looking for an alternative, the alternative may be better, it may not be better, it may be slightly better.
I think so. I think that, I mean, I think when it comes to tobacco products, there's really no safe product at all, especially when you're dealing with kids at such young ages. Your brain continues to develop until the age of about 27. So anything like that, I mean, whether it be tobacco, nicotine, marijuana, it all influences the way your brain develops. So when kids are introduced to these things at a very young age, I think it definitely affects them, and they become addicted very early. So you see them addicted to nicotine, and then it becomes very difficult to get off.
And I suppose folks that you deal with in your program, do you find that they're older folks, younger folks, a mixture of both?
I think it's a little bit of a mixture of both. I know for the pouches, for example, I know I keep going back to them because they're such a popular thing right now.
And they're popular especially with the younger folks, correct?
Yes.
Or the
younger
teenagers, maybe 20s, 30s?
I think they like to get their hands on the pouches more than anything because they're very discreet. They're able to
And they're
use
flavored.
them. Yes, yeah, exactly. And I know that there are a good deal of celebrities out there who are not young, they're not really old, but I've seen a number of them that use nicotine pouches. So you do see that. Someone off the top of my head, I can't think of his name right now, but he is a big nicotine pouch user, and he's in his 50s. It's James Brolin's son there, yeah. So he is.
Oh, okay, but I can't think of his name either.
Yes, I know.
James Brolin's son, okay.
Yes, so he is a big nicotine pouch user. So I've seen interviews with him even where he says he's really not able to get off of them. So that's the other issue I think that happens with pouches is whether it be a kid or someone older, you get involved with these pouches and it's very difficult to let them go.
And what young folks and maybe older folks might not be aware of is the algorithms.
Yeah, absolutely.
So when you're going through your phone, when you're searching these social media sites, you may simply see a lot of these influential pieces that are a result of the algorithms.
Absolutely. I mean, we all know if we're looking up something online and you sort of click on something, then you tend to get more of whatever the information is that you're looking at, whatever the topic is. So when kids, same thing, if they're doing that, if they're looking at something that is related to smoking or vaping, chances are they're going to get a lot more of that. So those algorithms are going to continue to pop up. And that's something, again, most kids are on social media every single day, so they're going to be exposed to that all the time. And the more they see it, the more it's going to be in their mind.
So we talked about peer pressure, we talked about advertising, we talked about these algorithms that pop up certainly on social media. What is, I guess all these are gateways to a life of an unhealthy life.
Exactly. As I mentioned, being so young and being exposed to things like nicotine and tobacco, it makes it very difficult to quit it. So if you become addicted to those things when you're in your teens or even your early 20s, it just makes it harder and harder. I mean, I'm working with several people right now who are older, who have been lifelong smokers. And I've had one or two people mention that to me, that it's been such a big part of their lives. Most people start when they're very, very young, and it just becomes harder to kick it. Most people will have a quit attempt anywhere between 5 to 7 times before they actually get it right. So it's a matter of just a lifelong addiction to whatever it is, if it's smoking or vaping, and it just becomes, the more time goes by, it just becomes more and more difficult to quit it. And
talking about social media and research, so when you research reputable corporations, reputable health organizations. So be careful where your research comes from.
Exactly right. That's what I mean. It goes back to just not always trusting things that you see online, and you want to make sure that you are researching things in a reputable place. If you're looking up health information, there's always the ones that have been around for a long time. You have WebMD and some of the more reputable organizations, hospitals, things like that. And that's where you'd be best to get your information from.
I know the Mayo Clinic.
Yes, exactly.
It's a good one as well.
Thank you. Yes, Mayo Clinic is a big one. That's usually a go-to for people. And that is really, authentic information right there. And you know that it's information that's truthful. So you want to make sure that you're doing that. If you depending on AI and things like that, which is becoming easier, I think, for all of us to do, it's not necessarily accurate.
Well, and that's a good point as well, because with AI, someone that doesn't smoke, let's say a celebrity that doesn't smoke, could look like he or she is smoking.
Exactly. It's I find it so amazing now. I mean, you're seeing more of it now, when we're online, and we all have access to it now more often than we had before. But it really is amazing how that works. They can easily manipulate anything to make it look like somebody is smoking when they actually aren't. And those are all things that kids are aware of today.
So other than, or you can mention it again, other than the brain, which is still developing in young folks, what are the other health hazards that can follow you throughout life? In other words, a young adult may say, I'm young, this won't hurt me. If I did it maybe in my 50s or 60s, yeah, I should worry, but right now I don't. I don't need to.
Right. That's always been the issue with younger people. They consider themselves forever young. They never imagine themselves being 40 or 50 or 60 years old or older than that. But short term, if you have kids that are introduced to smoking at a young age, you may have athletic young boys that are into athletics. They're going to notice that with their breathing. They're going to become winded sooner, that sort of thing. It just, the yellowing of your hands and that, all the little things that go along with smoking. It just becomes difficult you're going to notice as time goes on. It just makes your health, you're going to be affected by it in those ways. And I think the breathing part of it is very big. Again, if you're a young person that's active, you can't not notice that. You're just going to notice that walking around with your friends or just going up and down hills or stairs at school, that kind of thing, you just become out of breath. So those are sort of the short-term things, and then they just continue as time goes on. Of course, there's always the risk of emphysema. I think we may have talked once before about a young lady that was helping us out with the Massachusetts Tobacco Control Program, which I worked with years ago. She was only in her 20s, and she developed lung cancer. And she was going around into the schools while she could to speak to the young kids and let them know what could possibly happen. It started as emphysema for her. And when you would see her, it was very striking because she was such a young person, but she had an oxygen tank. So she would come through the schools, and it was really an eye-opener for the kids to realize that this isn't always something that happens to older people. This is definitely something that can happen to you when you're young as well.
And it ages your face, it ages your
Absolutely.
appearance. You had mentioned the yellowing of fingers.
Yes. Yeah. And, as we talked about I think young boys with athletics and things like that, but that's a big one for the young girls. They're always so into their appearance and how they look. So smoking after a long period of time, and not even a long period of time, but if you're smoking a lot, even including vaping, that's going to really make a difference on, your skin, your face, just how you look, things like that.
Teeth.
Absolutely, your teeth. Oral, that's another thing when we go back to nicotine pouches. There's that increased risk of issues with your gums, issues with the inside of your mouth, issues with your teeth. So yeah, there's a lot that goes along with it.
So what would you say to young folks to do as an alternative? In other words, if there's this oral fixation, at least that's part of it. The other part of it is what nicotine does to your brain.
Right.
But I know in previous shows you talked about eating carrot sticks, eating celery sticks.
Absolutely. One thing that comes to mind is cinnamon. Cinnamon is excellent for cravings to smoke. It's been like that for a lot of years. I've recommended it to many people, and they do find it very helpful. I think just the hot flavoring of cinnamon, it helps you to get through a craving faster. So keeping things with you like cinnamon gum, cinnamon hard candy. I actually just this morning gave a couple of women I've been seeing some fireballs. You don't see them as often now. They're hard to find, but there's nothing hotter than that. But the cinnamon flavor is excellent for helping get through a craving. And also letting people know, no matter what your age, just to keep in mind that a craving doesn't last any longer than 10 minutes.
That's a good point.
Yeah.
Because if you wait long enough, which isn't that long, it will pass.
It absolutely does. I think we're so quick to give into it immediately without sort of taking a step back and saying, I know this craving will pass if I just keep myself busy with something. And if you do that, you will notice that after 10 minutes, that craving goes away. And it becomes easier the more you do it.
Regulation, we talked a little bit about regulation and how that's changed over the years. Big change in this state was secondhand smoke and how that's not acceptable. It's not acceptable to be smoking in restaurants, bars.
Absolutely, yeah, and we've had that law in place for quite a while now, but you have secondhand smoke, and then you also have something called thirdhand smoke. Now, the environmental tobacco smoke. The secondhand smoke is the smoke that affects the people around you. Younger children can be affected, increased risk of ear infections, things like that. Pets, any pets that live with people who smoke, they can be affected as well. And then the third-hand smoke is the smoke that sort of settles into your furniture. If you're someone that smokes at home, in your car, if you're a car smoker, on the walls, on the windows, things like that. So.
And we talked about the appearance of your own self, the teeth, the skin,
Absolutely.
the yellowing. That happens in houses as well, the yellowing of the walls,
Yes.
The kind of film that rests on things within a room.
Absolutely. We have thousands of chemicals that are in cigarette smoke. So all of those chemicals over time are going to create, just as they create problems with your lungs and the inside of your lungs, they're going to do the same thing if you're smoking inside. If you're enclosed in a space and you're smoking all the time, you will see that. And when people decide to quit and they start to do some spring cleaning, they notice if they're cleaning windows and walls that is very brown, what you're cleaning off, and that is all the junk really that's included in the cigarette, all the tar, all the chemicals that are included. And I often think if that's what you're seeing coming off of your walls and windows, you can only imagine what's going on in your lungs. So it's
so my
a big
thought
deal.
is here's a challenge, right, for younger folks, for anyone really, to maybe start posting healthy.
I try to remind people, no matter how old they are when I'm meeting with them, that it is possible to get addicted to healthy things. We think addictions, we always think things that are bad for us, and most of the time that's the case, but it certainly is very possible to get addicted to things that are healthy for us. Getting addicted to working out, eating healthy, walking more often, drinking more water, things like that. So if we did have more younger people going online and promoting those things, it would be great to see.
And what do you say? I know at a certain point, parents might feel like they don't have control over their children, especially at those teenage years. What would you say to parents as far as being active in your children's or your young adult's life?
I think I would tell any parent to just sort of try and be cautious of what your kids are looking at online, sort of pay attention to the things that they're looking at. And if you suspect that they're smoking or thinking about smoking or, that sort of thing, just talk to them, to sit and talk to them. I think it's important to talk to your kids, let them know really at a young age, just the dangers of smoking. And you kind of want to stay ahead of that. And you want to make sure you talk to them before they get out there and they see all these things that might influence them.
And I know part of what you talked about too was the emotional support that will drive someone to smoke. So that's obviously an aspect that needs to be considered.
Yes, absolutely. It is important to have.
I'm just thinking of a college student that's studying for exams and they know that this is going to be a tough exam.
Right.
They might take up the bad habit because of that.
Absolutely. Yeah, those again are the years and the ages that you really need to be cautious about, because those are the times where you can see people likely get addicted. So and that's a perfect situation. You might have a young man, a young woman who's in college and they feel like they're feeling the stress of finals and things like that. So they might have friends who are recommending smoking or vaping or even the pouches. Again, they're becoming very, very popular. So those are the things that you want to make sure that you don't. And, there are other ways to get through the stress. It's just kind of taking little breaks for yourself, or I think you can take advantage of the mints and the gum and all those things just as well as you could if you're trying to quit smoking. So there are always things that you can do.
And where you said 10 minutes, the craving goes away, I'm thinking of a 10-minute walk.
Absolutely. It's true. A quick walk around the block or just around the building that you're in, that sort of thing, or just getting up and moving into a different room. Anything that you do differently. It's all part of the 4 Ds that we talked about before. Doing something else, delaying, putting that craving off, just waiting the 10 minutes and keeping busy with something else.
And I just want to come back around when we were talking about parents having this discussion with their children or with their young adults, be careful that you don't accuse. So I guess it's the approach, because a kid, a young adult, could shut their parents off, and then nothing gets through to them.
Exactly. It absolutely is true. You have to be able to talk to your kids in a way that you don't want them to feel like you're telling them, or you're sort of like demanding that they stop doing something. But just an easy approach, and just sit and talk to them and ask them how things are going, and if anybody that they know is smoking, and how they feel about it, if they ever felt like they wanted to try it, and just let them know that you're there to support them. And if anything ever were to come up, you can talk to them, and they don't have to feel afraid to mention it to you.
Well, I like that. I like the fact that you mentioned support, because that's ultimately what it is.
Absolutely, it is. You don't want, the last thing that you want for your child is to be afraid to come to you and tell you that they're thinking of something, or something's been going on. So you want to make sure you're talking to them and let them know that you understand. I mean, I think most parents do understand. We've all been in those situations growing up where there's something that can be a temptation, and you want to talk to your kids and let them know that you do understand how it is.
Very good. Any last minute thoughts? I think we covered this topic quite well.
I just think, again, as we just talked about, I think if we had more younger people online promoting non-smoking and healthier activities, it would just make things a lot easier for a lot of the younger people out there, and they wouldn't have as much influence on these things that we're seeing pop up everywhere.
So I would say start that trend, right?
Yes, right. Absolutely. Yes.
Thank you, Christine. Always a pleasure.
Of course. Thank you. Thank you, Mark.
And thank you at home for watching. And please remember to stay healthy. Stay healthy. Certainly, you can avoid the bad habits. And also continue to support the local access station in the community in which you reside. Take care.